Hello, welcome. I'm Rosie. I'm a perinatal psychologist, and I'm here today to talk to you about the importance of continuity of care in your next birth after birth trauma. So, we know that preparing to give birth again after a previously difficult or traumatic birth experience is not easy. In fact, it's usually a huge physical and emotional challenge for most women and their partners, and sometimes the entire family system. So we know as well that that is 1,000 times harder if you are having to deal with a different person at every single appointment that you turn up to and kind of feel bounced around from pillar to post, having that really inconsistent, fractured experience of care. When we talk about continuity of care, what we're talking about here is having the same named care provider, or sometimes it's a small group, but sort of essentially still you know them, you know who they are, all the way through from the beginning of your pregnancy up to giving birth, during the birth itself, and afterwards. And that's that idea that you have that kind of continuous experience of being cared for during your birth. Now, we know that women want this. In fact, it is probably the biggest request coming through from women in Australia, around the world, for our maternity system today. And I think partly that's in response to the huge rates of birth trauma that we have been seeing in recent years, and the recognition, I think, that for most women, we know that if we get the chance to work with one person, we are more likely to be able to get our needs met emotionally as well as practically for that birth. So let's have a think now about how you can get continuity of care for your next birth, because the reality is it's not easy. Unfortunately, the system still has a long way to go to catch up with women's requests. And at the moment, only about 40% of women will have any kind of continuity during their care during their pregnancy and their birth. And often even that is kind of patchy. So you might work with the same obstetrician through your pregnancy, but they may be in and out of your birth and there'll be other people caring for you, and then you might not see them again until your 6-week check. So it's actually quite tricky to access that proper continuity of care. There are other factors going on with that as well, right? So one of the things that I find really challenging is that where we are based geographically can determine how much provision there is of continuity of care in your area. So you might find that if you're in a metro city, you can kind of have some more of that continuity of care models like midwifery group practices, but that really depends on kind of what state you're in, what city you're in. And if you're living regionally, all of this gets shrunk much further down, and it's much harder to actually access the continuity of care that you need. The other thing which comes up a lot with the mums that I work with is that, unfortunately, even though women after who've experienced a previous birth trauma are probably have the highest level of psychological need for that continuity of care in their next birth, often if there's been a previous complication or level of intervention required in your birth, which is not all birth trauma, but definitely, can be part of a lot of traumatic birth experiences for a lot of families, then if you've been through that, you actually might find that this prevents you from being able to access the continuity of care that you so badly want and need, and I would say deserve. And this is because the medical system pretty much just looks at those medical risk factors, and they're looking at the physiological risk factors. And unfortunately, that can mean that you don't get to access the continuity of care in the public system as you probably would really like to, and might emotionally and psychologically really need to. So as I said, today I'm going to just be going through 5 ways that you can potentially access more of that continuity in your birth, so that this can help you prepare and experience a much better pregnancy and birth this time around. So look, my first tip is that as soon as you find out you are pregnant, and possibly even before if you want to be doing some research just to help you feel more prepared to even try to conceive another baby. But definitely as soon as you find out you were pregnant, hit the phones and call your local midwifery group practice. Okay, so find your local hospital, find where the maternity system is, ask to be put through to the midwifery group practice. They will be able to tell you, firstly, whether or not you're eligible and whether you can kind of access that service. If you can, you want to be on that waiting list and get a place nice and early in your pregnancy so that you can be more likely to be able to get in, because they are, understandably, if we don't have as much access as we should, those programs where you get to work with a small team of midwives and get to know somebody and then the others as well as you go through your pregnancy, those programs can be quite sort of oversubscribed. So getting in early and getting on the list if you're eligible. The other reason why I suggest doing this step and actually calling them is because they'll be able to let you know if you're not eligible, and you want to find that out early on. It can be really difficult news, but it is something that you can use to spur you on to start thinking, okay, so not that, what else is available to me? And so there are some other options that you can explore that can help you find that continuity of care in your next pregnancy and birth. One of those, which you also might need to do some research before pregnancy or hit the phones as soon as you see those 2 blue lines on that test, is hiring a private midwife. So a private midwife gives you that continuity of care. You get to work with somebody throughout your birth, pregnancy, postnatally, and they can be an incredible way to access a kind of low intervention or reduced intervention approach to birth that has the kind of the best evidence outcomes for midwifery care. Sometimes you'll have private midwives who will support home birth. Others have admitting rights to your local hospital. So do your research, find out who is available in your area, find out from other mums and get some kind of reviews of them if you can. They can be an incredible resource if you manage to be able to and can afford to hire a private midwife. Again, they book out and they're not always easy to access. So this is something that I always recommend doing as early as possible in your pregnancy, and seeking out kind of meeting with a few people to see who's going to be the best person for you if you can. Now, a private midwife with whether that's birthing at home or in the hospital is not going to be for everybody. So you might find that you would prefer to work with an OB, an obstetrician during your birth, and have more of that kind of medical-led support during your birth. Now, if you're looking for an intervention-free or kind of want to reduce unnecessary intervention in your birth, that may not be the best choice or model of care for you, because we do know that birthing with an obstetrician and obstetrician-led care is associated with higher levels of intervention, higher levels of cesarean section, and so on. And sometimes some of those stats are because obstetrician-led care does tend to support people who are at higher risk, but there's also perhaps just an increasing medical approach to birth. So if that is not a primary concern for you, or if for you know that you have medical risk factors that you want to be really, really closely kind of monitored and looked after throughout your birth, then you might find that birthing with a private obstetrician who can understand your previous experience and work with you to put the things in place that you need for this next pregnancy and birth, that could be awesome for you. So that, again, I would always recommend seeking out reviews, looking online, trying to find out from other parents in your area who's birthed with someone, and really getting a sense of like what it feels like to work with them. And that can be something which can be hugely beneficial in your next birth. Now, if we look a little bit outside that immediate kind of midwifery or obstetric-led care, there are a couple of other options that you can explore to bring in that continuity of care into your birth team, even if you can't access it through your kind of primary care provider. So this is what I mean if you can't get a private obstetrician, or you can't get into the midwifery group practice, or you can't sort of afford or don't want to choose a private midwife. There is the option of going through either shared care with your GP and the team midwifery practice at the hospital, or perhaps just being in that sort of shared midwifery team sort of system, and yes, seeing a different midwife each time, but you can bring in some continuity into your team, either by hiring a doula or a student midwife. So firstly, let's think about hiring a doula for your next birth. A doula is a non-medical So they're not medically trained birth support or birth companion. So doulas can be a phenomenal way to access that continuity of support throughout the entirety of your birth. Some doulas will work with you sort of in pregnancy. Some will provide really great postnatal support as well. But essentially, when you choose to birth with a doula, I think about it as kind of beefing up your birth team. You're really getting somebody in there that knows birth and can provide a combination of practical and emotional support for you throughout. So as with any professional that you're bringing into your birth, again, get reviews, interview them, try and get a good sense of what they're like, what their views on birth are, and how they'll support you. And have a think over the course of your pregnancy about what you want from them. Some will be amazing at that hands-on support, some will be more practical, some will be more emotional, and some will be amazing advocates for you. So make sure you have those conversations about what you want when you're hiring a doula as part of your birth team. Now, lastly, the last way that I often suggest to the mums I work with about how to increase that continuity of care during birth is to request a student midwife. You don't hire them, they're free. And so you get to actually have somebody working with you. Yes, they're part of the hospital system, but they can actually be allocated to you and work with you throughout your pregnancy and be there at your birth and support you postnatally as well. So this is actually a really good free way to get that kind of support in your birth. Now, student midwives, they are of course students. Some of them are wonderfully experienced, very passionate about birth, very passionate about supporting you. You are likely to be able to build that relationship with them, and then they can have a chance to get to know you, get to know what you want and need from birth. And whilst they work within the hospital and they may not feel confident given their role as a student in that hospital to kind of advocate for you or push up against kind of procedures and policies, they will be able to talk you through what those procedures and policies involved that you might be bumping into, and provide a useful sounding board for you to work through some of your concerns. So those would be 5 ways that you can access continuity of care in your next pregnancy. And I have to say, finding a care provider that you feel safe and comfortable with in your next birth is probably the most important decision that you can make. So if you're watching this, I would encourage you to seek that out. There are so many things that we can do to prepare for a better birth experience next time. And this really is the central one. We know that we need to feel safe in birth. We know that you want to be supported to be the key decision maker in your birth and have that protected for you. And really, in my opinion, there's no better way to do that than to set the scene by making sure you can have that relationship with somebody who understands what you've been through before, understands what you want from this next birth, and can actually support you to stay in the driving seat during this next birth, and have a much better birth experience, no matter what twists and turns the birth ends up having. If you would like more support or advice on how to prepare for another birth experience after a previously traumatic birth, I'm Dr. Rosie, and we have heaps of resources for you at the Birth Healing Collective. So you can head to our website. We've got some free guides and downloads and other resources as well. So hopefully some of that will be useful to you. Thank you.